welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Mercy Udoji. She is an anesthesiologist and she wrote the Kevin MD article, When an Epidemic of Violence Against Healthcare Workers Meets a Pandemic. Mercy, welcome to the show.
Thank you so much for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
I'm originally from Tennessee. I did my residency training at Duke in North Carolina. Then I did an interventional pain fellowship at Cornell in New York. And after that, I came back south where I've worked in Birmingham, and I'm currently practicing in Atlanta, Georgia as a pain specialist and an anesthesiologist.
And we're speaking towards the end of December. And from a pandemic standpoint, tell us what you're seeing either in the hospital or in your practice.
Well, first thing I'm seeing, honestly, is hope on the part of the healthcare workers. You know, it's been a very long 6, 9, I forgot how long it's been. We've just been head down. And so the idea that we may be finally emerging from this pandemic it's just amazing to me. And yeah, we still have a lot of volume, still have a lot of patients admitted, still have a lot of healthcare workers that are being, testing positive for the virus. But at least from mine and my colleagues' perspective, there is finally light at the end of that long tunnel.
And as we approach almost a year of the pandemic, tell us something that you've learned during these last few months.
I have been outstanding at the dedication of a lot of my colleagues who are in the ICUs, in the ORs, intubating and caring for the sickest of the patients. And they do so very selflessly and day in and day out. And I know healthcare workers were a dedicated bunch of baseline, but just to see it manifest when this pandemic came out to me is it's just been an eye-opener.
All right, so let's transition into your Kevin MD article. When an epidemic of violence against healthcare workers meets a pandemic. Now, for those who haven't read the article, can you just walk my audience through it and share the story of why you decided to write it?
So the article itself begins with a semi-fictionalized encounter between an irate patient and a healthcare worker. And then it discusses in depth the statistics, the very bleak statistics when it comes to healthcare worker safety, whether from patients or from other factors, and then goes into the fact that we don't have a lot of data, a lot of information, and the reasons why we don't have a lot of information about this epidemic, whether it is due to lack of reporting on the part of healthcare workers or lack of support on the part of healthcare facilities in general of those who do report these issues. And it just ends by saying we need to pay more attention to this issue, and we also need to support our workers and as we care for our patients. Without a healthy healthcare worker system, you can't provide good patient care. And my interest in it really stems from my practice in the interventional pain clinic, as well as my experiences in the OR and my interest in medical quality. As I began to, just due to experiences I've had and experiences my colleagues have expressed to me, I began to look more into this topic, initially from a patient safety perspective, because a lot of people don't know that workers who are affected by healthcare violence have been shown to provide less quality care. They are more prone to make errors in the care of the patient. They spend less time with the patient. They call out more, which means that if you go in, you're more likely to be treated by someone who is less qualified due to the fact that they experienced and that, that people who were normally there may call out more often because of these things that happen to them. My goal when I began to look at this was to shine a light on the topic. And then I realized sort of how deep the hole went. And the more I looked, the more I realized how very little data there was, especially in the field of anesthesiology and interventional pain medicine in general. There's a lot of data about ER, but not for our specialty. So my goal was to shine a light about this issue within the practice of anesthesiology.
And can you give us some specific examples of violence against healthcare workers, especially in your field?
So it could be someone who comes to the pain clinic, for example, who is requesting opioid medications. The physician or provider taking care of them might not feel that they're an appropriate candidate, so they refuse. What you end up seeing a lot of the times is the patient attempts either physically or verbally to threaten the provider or the physician into getting their way, or they may say things like, I'm gonna come back, you won't see me come in, I'm gonna wreck you. One of my personal experiences, I'm gonna put it out there, was that when I was 6 months pregnant, in my clinic, it was a late afternoon, had a patient come in who had been discharged from the ER. He was seeking opioids for his low back pain. We had never seen this patient before. He came to my clinic as a follow-up from the ER. And when I explained to him that I would not prescribe opioids the very first time I saw him and went over the steps necessary to help manage his pain, he became very irate, began to crowd me, and was so loud that my neighbors, my office mates, came in. And I was very glad that they were there, actually, because at that point I was stuck in a room with this very irate patient and not able to move as fast as I normally would due to my pregnancy status.
Mhm.
So that's just an example.
Now, of course, this scenario that you describe also happens in primary care. Now, can you
Mhm.
share some of the warning signs that physicians and other clinicians should look out for, and perhaps some techniques that you could recommend to potentially de-escalate situations like these?
I will start by saying that sometimes you don't see it coming, right? But things I tend to look out for are patients with history of psychological disorders. Not saying that they are more likely to do so, but sometimes psych- psychological disorders in combination with pain can be very difficult to manage. And patients in high stress scenarios, for example, if they're coming to me and they've been seen by the neurologist who said no to opioids, by the primary care physician who said no to opioids, then I already know that they're coming to me expecting certain things. And if they don't get it, they might be angrier than they would be in another scenarios. High stress clinical scenarios are also, important. Patients who are coming in for surgery due to cancer diagnosis or even their family members tend to be that way. Patients whose surgeries need to be canceled from the anesthesiology perspective for a variety of reasons. Perhaps their blood sugars are too high. Perhaps their urine tox came up with something that wasn't supposed to be there. And we have to explain to them, say, hey, this is an issue. Kind of feeding off that acute intoxication, patients who do present either high or on other substances for procedures and such, and needing to be canceled or having to interact with them to explain this is what's going on and this is why we can't do what you came here for today. That can be very upsetting. In the ICU setting, having to deliver bad news,
Hmm.
perhaps, these are all sort of scenarios that as a provider or a physician, you need to be aware and sort of work on skills. So in terms of skills, what I always do is to advise people to do is to take a breath, put yourself in that person's position,
Hmm.
and talk to them as you would want you or your family member to be talked to. Be respectful, be direct. A lot of the times patients aren't mad at the news, they're mad at the way the news is delivered. So being able to respectfully deliver news or information that the patient may not want to hear can go a long way towards de-escalation. And then being direct in your delivery and being empathetic in your delivery also helps to de-escalate that.
And you mentioned that there isn't a lot of data, especially in a field of anesthesiology, as to how often this happens. But for what you know and from your research, how common are situations like these, not only to doctors, but I guess to nurses as well?
The reason that we don't have a lot of information about this is twofold. The first is on the healthcare systems. There's not a lot of interest in this topic from a healthcare systems perspective. You can look at it as sort of data about falls in the OR or falls in the ICU, falls on the floor, etc. You see those purple wristbands, you see those stars everywhere. There's obviously an investment on the part of the hospital system to gather information about this issue and also put in systems and steps to stop it. So that's the first thing. The healthcare systems have to be interested. From a worker perspective, unfortunately, we tend to view these as incidents as part of our job description. In a recent survey we did, I think 60 to 70% of respondents indicated that they had been victims of workplace violence, either physical or verbal abuse or threats. But when you ask how many of them reported it, less than 50% reported it. And they don't report it until it passes a certain threshold. When you ask why, a lot of it has to do with, well, what am I going to do? What are they going to do anyway? Meaning that the health system is not going to put in steps or to protect the worker, so they don't feel like the issue is resolved to their satisfaction. So then there's no point in reporting it in the first place.
We're talking to Mercy Udoji. She's an anesthesiologist, and she wrote the Kevin MD article, When an Epidemic of Violence Against Healthcare Workers Meets a Pandemic. Mercy, how has the pandemic affected the incidence of workplace violence cases?
In my opinion, it made it worse initially. I don't have access to the more recent data. That same survey I was referring to that my colleague and I recently completed asked that question in terms of, do you feel as if the COVID-19 pandemic has exacerbated this issue? And the answer to that is yes, a majority of the time, yes. And the extent to which it will have long-term effects on worker morale and worker safety, we don't know yet. But it has exacerbated it because you have patients, who were coming into a high-stress situation. They're coming in for surgery, they're coming into the ICU. They're not there because they want to be, they're there because they have to be. Then you top that off with societal stress, financial stress, politicization of the pandemic itself, and people don't, so this is just a boiling cauldron that's just waiting to explode. And in some cases, it has done so in very spectacular fashion.
So if we're a clinician or a nurse and we receive a threat from a patient, or you're in a threatening position, what are some resources that we could turn to? Who can we report to? And what can we do if the situation just stops short of violence?
If it stops short of violence, I would recommend, first of all, getting yourself to a safe place. That should be your first priority. After that, the next step will be to document the event and then report it to your supervisor. There are often, in my healthcare system, there are ways to electronically report patients who behave in threatening manners. And you report to your supervisor and you electronically place that report. And then the supervisors have ways to escalate it so that the patient can either be counseled or there can be safeguards put in place to protect workers whenever the patient is being cared for in your facility.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Number one is be safe, recognize the environment that you're in, recognize this scenario, and just be safe and take steps to protect yourself and also to protect your patients. We as healthcare workers tend to prioritize patient care even above our own. But I will go back to the old saying that you can't take care of others until you take care of yourself. And we need to take care of ourselves better.
Mercy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you for having me.